Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Mwaka. First, the highlights. Edo State government receives over 40,000 more doses of Moderna COVID-19 vaccines after an initial supply of over 65,000 doses. Bauchi State government appeals to the media for vaccination campaign. And the European Union and AstraZeneca reach out-of-court settlement. Last night's new cases confirmed by the NCDC showed 631 new cases and 8 deaths were recorded in Nigeria. According to the agency, the figures were registered in 19 states and the FCT. Since last Friday, the 27th of August, when the country recorded 618 cases and the death toll stood at 2,308, 180 people have died due to COVID-19 complications in the space of almost a week. The message from the NCDC is that a person infected with the Delta variant may not show symptoms before infecting others, and for everyone to take responsibility. Here's more on the update.
The latest data from the Nigeria Center for Disease Control shows that the daily COVID-19 infections in the last 24 hours are at 631 amid the spread of the Delta variant in the country. The latest figures were reported from 19 states and the FCT, indicating an increase from the figures reported earlier. Lagos led the chart with 172 infections. 93 cases were recorded in Oyo. Rivers had 72. Edo had 63 cases, 29 cases were reported in Katsina, Abia had 26, while Kano and the FCT reported 23 cases each. Bayelsa and Ogun recorded 20 cases each, 18 cases were reported in Ekiti. Anambra and Delta had 16 cases, Osun had 14, and 11 cases were reported from Imo. There were 0 cases reported from Borno, Ondo, Sokoto, and Zamfara states. The overall count of confirmed cases in Nigeria now stands at 193,644. 294 people have been discharged in the last 24 hours, increasing the total number of recoveries to 179,294. 8 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,488. Over 640,000 eligible Nigerians have been vaccinated with the first dose of the Moderna vaccine, while over 56,000 eligible Nigerians vaccinated with the first dose have collected the second dose of the AstraZeneca vaccine. In Africa, there are more than 7.8 million confirmed cases and over 197,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 219 million, while more than 4.5 million deaths have been reported.
And Edo State has taken delivery of a second batch of Moderna vaccines, 40,000 doses. The first batch last month contained over 65,000 doses as the state continues its second COVID-19 vaccination phase. Speaking shortly after receiving the supplies at the Benin airport, the head of the state's primary healthcare development agency, in company of some members of the COVID-19 response team, said the turnout in the vaccination exercise has been very impressive.
We have a Moderna vaccine. Actually, we just received 40,012 doses of Moderna vaccine, accompanied with syringes to administer those vaccines, QR code, and safety buses. So, this is an additional vaccine. We know on the 20th, we received 65,016, and so far it's almost exhausted. We just have 13,000 plus balance in our state coastal. So we are just had asked for, requested for additional vaccine, which just got to us now. So I cannot really tell you whether this is going to be the last batch. Depends on how people come out to get vaccinated. Like if you remember what the governor said, we are out to vaccinate large number of our population. So by the time we exhaust this, there's room for us to get more. You know, the AstraZeneca was actually restricted for those that have taken their first dose before, and they are still coming out to take their second dose. So this Moderna is for those that have not been vaccinated before, and they are coming out in numbers to take their first dose. So the number is increasing. So, and that is why we don't want to rush out of vaccines. So as the number is getting to a certain level that we know we don't want to create out of stock phenomenon, we demand for more vaccines and they give to us.
Meanwhile, the second phase of the COVID-19 vaccination has become a major talking point in Edo State against the backdrop of the state government's position restricting access to certain areas for residents without proof of vaccination. Our correspondent Osaze Obaze has more.
At the primary healthcare center at New Benin in Oedo local government area, the staff of the center are at it, vaccinating people as they come. The head of the team seems impressed with the turnout of people for the COVID-19 vaccination thus far.
I would say that the turnout has been quite encouraging, but some persons are still scared to come out from their houses based on the rumors that they've heard concerning the vaccination. So when they come, we try to tell them, that as the clients, we try to tell them that the COVID vaccine is safe.
Welcome Primary Healthcare Center, Bauchi. It's another busy day of COVID-19 vaccination. The University of Benin Teaching Hospital is a hub for COVID-19 vaccination. The team head affirms that response has been good.
For this program, we are vaccinating those that have not had their first dose of COVID-19 vaccine. These are the categories of people that will give Moderna vaccines to. They are taking their vaccine for the first time. For those that have had their first dose of vaccination, they had AstraZeneca.
She just got her second jab.
I came here today to take my second dose of the COVID-19 vaccine. And then I would like to advise everyone out there who has not taken the COVID vaccine to please do so.
The senior citizen has just taken his first jab and he has a word of advice.
I believe strongly that a whole government cannot mislead us. I'm also a Christian, and the same Bible says we should obey constituted authority. So I wouldn't know why anybody will have reason to doubt an authentic government we put in place.
3 local government areas in Benin City covered. COVID-19 vaccination is up and running. Osaze Obaze, Channels Television News.
State where the Primary Healthcare Development Agency is worried about the rejection of the second dose of the AstraZeneca vaccine. The agency is also concerned about hesitancy being experienced in the second phase, especially in Bauchi North. In view of this, the agency is partnering with the media to avail practitioners with the right information while recognizing their role as critical stakeholders in the success of the vaccination exercise. Our correspondent Hajara Aliyu reports.
Bauchi State rolled out the second phase of COVID-19 vaccine on 21st August 2021 after taking stock of over 100,000 doses of the Moderna vaccine. Currently, over 6,000 residents have taken the jab. There are concerns about low turnout in some local government areas, and the Primary Healthcare Development Agency, Bauchi, seeks to increase uptake through the media.
Let's, first of all, get equipped with the appropriate knowledge, with the appropriate information concerning the disease itself, and then the vaccine itself, as well as the processes and procedures of the rollout of the COVID-19 vaccination.
We are not really very, very happy with what the turnout we are seeing. However, we are making a lot of effort to engage with media and all the relevant stakeholders so that our people will understand the reality about the COVID-19 infection, as well as also the importance of vaccine.
Data available in the agency also reveals that quite a number of people who were vaccinated during the first phase of the exercise are refusing to avail themselves for the second dose of AstraZeneca vaccine. Although some people are skeptical about COVID-19 vaccine, reporters have resolved not to give up on putting out relevant information.
And people keep saying, don't disturb us about this thing that is not really existing only in abroad and so on. So this training, has helped me to know that I'm doing the right thing.
Beyond using our platforms to sensitize the public, journalists have also been tasked to improve on investigative journalism. For instance, the issue of vaccine hesitancy. The media can actually dig deeper into why this is happening, and some of the findings could assist authorities in addressing some of the challenges. From the Emergency Operations Center in Bauchi, Hajara Aliyu for COVID-19 updates.
Thanks, Hajara. In September 2020, the World Health Organization announced the emergency use authorization of some antigen-based rapid diagnostic tests, RDTs, for COVID-19 testing. According to the NCDC, RDT does not replace the use of the polymerase chain reaction, PCR, and should be used in combination where required, depending on the epidemiological situation, clinical history of the individual. We're joining us for more with regards to where RDT is in Nigeria is Mr. Anthony Ahumibe. He's a senior laboratory technical advisor with the NCDC. He joins us virtually from Abuja. Thank you for joining us on the program. Tell us, where is Nigeria with RDT?
Thank you so much for welcoming me. We have validated in country the two antigen-based rapid diagnostic kits that have gotten emergency use authorization from WHO. After that validation, we went ahead to do some webinars just to socialize these among users, telling them how to use them and where to get them. We've also done provided a guideline and algorithm on the use of this online. In addition to that, we facilitated some level of training regionally and in some states to cascade the technique that is needed to adopt and make sure that people begin to use this. So essentially, that's where we are at the moment. Having done this, some states have actually using RDT for their testing.
Who are these states? I mean, how many states are using RDTs, and are they open to it? And why are the others not using it?
So by the last count, we have about 20 states that have requested rapid diagnostic kits. Remember, these are all antigen-based rapid diagnostic kits from the NCDC, and we have deployed to them. We started initially by formulating a strategy with these states using the secondary health facilities, just a way to adopt a system that allows them to have a differential testing for those who present with any of the symptoms. But we've gone beyond that to develop strategies with states that are now looking at congregate settings. So initially, 6 states started with adopting this strategy at the secondary health facilities. But we've added another 16 states who are now using it based on other strategies like using it in schools, using it to test around public facilities, penitentiaries, IDP camps. The only state, based on the question you asked, that hasn't really accepted use of RDTs in the state is Lagos State. But we are also working with them. The reasons why they are a bit skeptical in application of RDTs is about the attributes, the scientific attributes around specificity and sensitivity of the kits. Recall that these are emergency use approved kits. They are the best we have at the moment. So we are also discussing with Lagos State. That is essentially one of the reasons why we developed a national algorithm to enable a very reasonable interpretation and use of these kits. So at this level, we are discussing with the Lagos State government to understand this algorithm and how to use it in their state.
All right, I have quite a number of questions, but we have to go now. Hopefully you can join us on the program again to talk more about the rapid diagnostic test kits on COVID-19. Thank you so much to Mr. Anthony Ahumibe. He's a senior laboratory technical advisor with the NCDC. Thanks again.
Thank you so much.
Still to come, most African countries to miss the goal of vaccinating most vulnerable 10% against COVID-19 by the end of September. That's in a moment. Welcome back. The World Health Organization says 42 out of Africa's 54 countries are set to miss the goal of vaccinating the world's most vulnerable 10% against COVID-19 by the end of September. UN spokesperson says countries need to move forward with their plans to rapidly vaccinate the millions of people that still face a grave threat from the coronavirus.
42 of Africa's 54 countries are set to miss the goal of vaccinating the world's most vulnerable people, the world's most vulnerable 10% against COVID by the end of September. Almost 21 million COVID-19 vaccines arrived in Africa through the COVAX facility in August alone. This is an amount equal to the previous 4 months combined. And the African, with more vaccines expected from COVAX and the African Union by the end of September, WHO says there's a possibility that enough doses could be delivered to meet the 10% target then. As more doses arrive, African countries have to move forward their plans to rapidly vaccinate the millions of people that still face a grave threat from COVID-19. This was said by Dr. Moeti, WHO's regional director. Currently, 39 million people, that's around 3% of Africa's population, is fully vaccinated.
The European Centre for Disease Prevention and Control, ECDC, has said that all the vaccines approved for use in the EU have been proven to be highly effective in limiting the severity and spread of COVID-19, and that governments should focus on continuing their first-round vaccine programs rather than prioritizing possible booster shots. Meanwhile, some companies around the world are making COVID-19 vaccines a requirement for employees. Many hope the mandates will encourage more people to get vaccinated. Well, Deutsche Welle correspondent Chelsea Delaney joins us for the latest on Germany's position. Hi, Chelsea. It's legal for employers in Germany to ask workers about vaccination status, but there are currently discussions over whether that can be changed. What's going on?
Yes, politicians in Germany have been discussing this week what the legal possibilities are for a vaccine mandate. The issue with requiring vaccines in Germany is that health information is really paramount here. It's very heavily protected by law, largely because of Germany's history with state surveillance under the communist and Nazi regimes. So employees aren't even able to ask employees if they've been vaccinated, let alone require one to work. But there can be exceptions, particularly if the risk to employees' health outweighs the risk to their privacy. So the Justice Minister, the Labor Minister, they're exploring right now whether there may be possibilities to change the law in some cases. As it stands now, employers do have certain tools to protect workers. They're required to offer their employees coronavirus tests. They can mandate social distancing or mask wearing and give other incentives like money or time off if they do get vaccinated. But as employees start to return to offices and also as the vaccination campaign begins to slow, many employers argue that it's really crucial that they know who is vaccinated and have stronger tools to encourage or, in some cases, force vaccinations.
Also, I mean, it seems politicians particularly are open to easing the rules for high-risk workplaces. What exactly does that mean?
That is a proposal we've heard from both the Justice and Labor ministers this week. They believe that in certain situations where workers are at a high risk of contracting the coronavirus, it may be legally possible to mandate vaccines. This would affect primarily the healthcare industry, so people working in hospitals and nursing homes with the elderly. And in those cases, they say the only way to really protect people, protect workers, is to require a vaccine. And it's important to note that there already have been exceptions made throughout the pandemic to health privacy laws here. For example, the fact that we have to show a vaccine or a test certificate to go into restaurants or bars. So there is precedent, but in Germany, privacy is very important. So while we might see vaccine mandates in certain situations, it's very unlikely to become a general rule.
Give us an idea of the picture globally. Many other countries have already implemented vaccine mandates for some workers.
Well, it of course depends on the laws of the country, but definitely we've seen many countries moving a lot faster than Germany to address this question of mandatory vaccines. In Europe, France, Italy, Greece have all already introduced vaccine mandates for healthcare workers. The Italian Prime Minister Mario Draghi has recently said he's considering a general vaccine mandate for everyone in the country. In the U.S. as well, many companies like Walmart or Disney have introduced vaccine requirements for workers in hopes that that will help to restart the vaccination campaign there. Delta Airlines is even considering fining employees $200 every month if they don't get vaccinated. And outside of Europe or the U.S., we've seen countries like South Africa or Australia or Indonesia all introducing some form of vaccine mandate as well. So I'd say Germany is definitely a bit of an outlier here.
DW correspondent Chelsea Delaney for us there in Berlin. Many thanks. And the EU and UK pharmaceutical company AstraZeneca have settled a vaccine delivery disagreement out of court. The European Commission had taken legal action over vaccine supply. There's more on this and other developments on our global COVID-19 update.
The European Commission and UK pharmaceutical and biotech firm AstraZeneca have reached an out-of-court settlement on the delivery of COVID-19 vaccines ordered by the bloc. The European Commission had taken the company to court for not upholding its end of a contract to supply COVID-19 shots.
Today, the European Commission and AstraZeneca have reached a settlement agreement which will put an end to the pending litigation cases before the Brussels court. This settlement agreement secures the delivery of the remaining COVID-19 vaccine doses to member states due under the advance purchase agreement. Under this settlement agreement, AstraZeneca has the firm commitment to deliver, in addition to the 100 million doses which have been delivered by the end of the second quarter of this year, another 135 million doses in 2021, and 65 million doses by end of March 2022.
Speaking of vaccines, Australian Prime Minister Scott Morrison has announced that Australia will receive 4 million doses of the BioNTech-Pfizer COVID vaccine from the UK as part of an exchange deal. The announcement comes as Australia's New South Wales reported its highest number of new cases and deaths despite being under strict lockdown measures for the last 10 weeks.
And so on a difficult day like this, it's important to bring hope. And I can assure you there is hope. There are 4 million reasons to be hopeful today. Because the government has been able to secure with the government of the United Kingdom a Pfizer swap deal which will see 4 million doses of Pfizer come to Australia this month. The plane's on the tarmac now, it'll be leaving tomorrow, and those doses will be coming over the course of the next few weeks, which will see us double the Pfizer doses that we have during September. This means from Downing Street to Down Under, we are doubling down on what the Pfizer doses are here in Australia this month. This will enable us to bring forward significantly the opportunity for Australia to open up again under the national plan.
South Korea has extended social distancing restrictions to October as the country attempts to boost its vaccine rollout ahead of a Thanksgiving holiday later this month. The Prime Minister says the strictest Level 4 restrictions in Greater Seoul and Level 3 measures in the rest of the country will last till October 3rd. And finally, officials say a new variant of the coronavirus named after the Greek letter of the alphabet MU, which was first identified in Colombia in January, is now the South American nation's predominant variant and the cause behind its deadliest wave of infections yet. Nearly 2/3 of tests from people who died between April and June came back positive for the MU variant, with 700 deaths per day.
Remember that not everyone infected with COVID-19 shows symptoms, and you need to maintain a high index of suspicion and also adhere to the preventive measures. Continue to, of course, take responsibility. Visit our website for more updates. You find a better understanding of the pandemic, plus other stories, breaking news at channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.